It's my privilege to introduce our next speaker, Jennie Joe, of the Diné, commonly known as the Navajo people of the Southwest. Jennie Joe, PhD, Masters of Public Health, um, is a professor emerita in the Department of Family and Community Medicine at the University of Arizona's College of Medicine. Her tenure at the university included directing the Native American Research and Training Center, in addition to holding an affiliate faculty position in American Indian Studies. Currently, she continues to be involved in several national and international committees, including the Institute of Medicine and the National Library of Medicine. Professor Joe was one of the founding members of the Board of Trustees for the National Museum of the American Indian. Jennie?
Good afternoon. This afternoon session starts talking about other types of health concerns, I think, that go across many different Native nations in this country. And increasingly, we're very much concerned about the environment and its impact on what's happening that's breeding illness and other types of misfortune among our Native communities. The WHO just released a report very recently indicating that 7 million annually deaths are due to pollution. We talk about the need for safe water, safe food, the need for a safe environment. And I think we are hoping, or at least I hope, we're becoming a lot more conscious of what this world does and how it impacts our health, and how we might be able to come to some resolution to resolve some of these things. One of the things that's at the core of many of the philosophy of Native people is the reference to the notion of everything is interrelated. The one that's often quoted in many cases is Chief Seattle's. This notion about everything being interwoven. And he says, mankind has not woven the web of life. We are but one strand within it. Whatever we do to the web, we do to ourselves. All things are bound together. All things are connected. This place in the web of life is something that I think we need to remind ourselves that we hear Native people having such strong relationship to the land. And I think that in many ways, we need to go back and ask, what does that mean? The identity held by most Native peoples is defined by the land and the sacred places where the physical world is merged into the physical, the spiritual, a seamless blending of the natural and supernatural. And in this environmental place, the oral traditions and the cosmologies place the world of Native people with intimate and inanimate living beings, the present and the past. Maintaining harmony within this holistic relationship was religiously observed as it was deemed essential to the well-being of the people and the environment. There have been many changes that we observe today. One of them has to do with the fact that in this world, 25 to 30% of the global burden of disease is attributed to environmental risk factors. And of all places, children under age 5 bear the greatest burden. We are finding, for instance, increasingly these types of risks are found and becoming more prevalent in many of the indigenous communities that are brought on by a variety of different economic developments. Other cases of death that we observe are also linked in one way or another to environmental factors. When we talk about health, we start looking at those markers that include what causes death, what are the most common type of illness that are being treated. And see, these kinds of things become our source of information on which then we make decisions. And we look at population and say, okay, this is their leading cause of death. And for Native people, we have disease of the heart, cancer, unintentional injuries, and diabetes, primarily type 2 diabetes, as the leading cause of death today. The life expectancy is another measurement that we use, and in this population, they're lagging behind by 4.1 years than the rest of the population in the United States. We have a lot of explanation for why this situation exists, including inadequate education, persistent poverty, discrimination, cultural differences, etc. When you start looking at these major leading causes of death and you think about what's behind them, you also realize that environment is a big player in these types of health concerns. When you're talking about heart disease, oftentimes it has something to do with poverty. Poverty because it may limit the kind of food that a person might eat, have access to, or the place that they live might not have an opportunity to give them a place to exercise, to walk, or have any of those kinds of physical activities that have been part of their lifestyle before. And we talk about the food behaviors and personal behaviors that become part of that. If you're constantly disenfranchised, you're more likely to look at the world differently, and you may be depressed and frustrated. And certainly finding other means to fill that void or to treat that void. Cancer is definitely related to the environment. We know contamination often happens in the most undesirable part of our communities, where there are a lot of soil pollution, air pollution. We also know that stress is a major part of this kind of cancer, and it is really related to a variety of other health problems as well. And we know lifestyle behavior. If you're a smoker, your chances of getting lung cancer are higher. And so all these things come into play when we start talking about the role of environment and health. Unintentional injuries also has environmental relationships. It has to do with poor road conditions, for example, and maybe unsafe vehicles, because if you are poor living in a rural area, oftentimes you don't have the safest vehicle or can afford to have one of those. And the other has to do with unsafe types of things that surround you. And many of that has to do with the high prevalence of maybe substance abuse that might be happening in those communities, and considered maybe the norm instead of the abnorm way of life. So all of these kinds of fall into place. Native people, in comparison to the rest of the population in the United States, are relatively young. Young people take a lot of risks. They have high-risk behaviors. If you go on a college campus, you see that risk behavior because young people think they're going to live forever, that they're invincible. If we take a look at diabetes, we again turn back to the notion of health, lifestyle, and the variety of other things that come via environmental factors. And that has to do with unhealthy diets. And it has to do with the whole sense of hopelessness, that this is a disease that can't be conquered. It's going to happen to me. It's kind of like waiting for that X to kind of fall on your path and you become part of the statistics. And I think the other thing has to do with the notion of being unhealthy is considered kind of normal. If we see people walking down the street and have been going in at all these fast food places, we tend to think, people have unhealthy foods. But maybe that's the only thing they can afford. And if you live in inner city, some places don't have fresh vegetables or fresh fruits that might be available to you. And if they are, they're very costly and may be hidden behind all the other fast food and unhealthy food substances that are in your fingertips. I think the other thing that is there is the whole issue of lifestyle change. We often look at photographs of Native people, you know, 50, 60, 70, 80 years ago, and you see them very slim and they look very, very healthy. And now we don't have that picture anymore, and we're really trying hard to change that and make it so people go back and look like their ancestors of a few decades ago. The other whole area is social cultural change. I think these kinds of things have really impact health, and some of them are environmentally related. Being placed on a federal reservation or a federal territory with limited access to a variety of healthy foods, or even the freedom to come and get these healthy foods, makes it very, very difficult. The whole history of institutionalization that placed people on these reserves, followed by food ration that only delivered food that were very unhealthy for you, is another example. Oops. These things are, I'm trying to read here and not look over there because I was told not to. So it's kind of complicated. Anyway, I think we can go back in history, and as it's been already mentioned before, is we can look at the kinds of things that have changed that environment for us. With the coming of the Europeans, of course, we got introduced to new pathogens that have come, the epidemics that have wiped out many, many generations of people because these were coming back in cycles over the years. We also know that new livestocks, new plants were introduced, and sometimes very harmful to the natural flora and the resources that were available in the environment. The kinds of resources that were utilized by most Native in their communities. The other is a forced removal. When you move people from one area to another, that's a whole new orientation to a new environment where there might be unfamiliar plants and the kinds of climate change, the kinds of things that really change even the resources you might have to build a home or even to have a successful garden are all challenged for a variety of this. The other is the emotional destruction that happens with that. In addition to being taken out of your familiar surrounding, are all those things that in the environment bring you peace, such as maybe sacred places, such as maybe places where your ancestors were finally laid to rest and where you still have obligation to protect them. It might be the place where the umbilical cord and the placenta of your baby was buried, to tell Mother Nature, we are tied to this land. My child is tied to this land. And all of this is taken away. You're in a new place. You're in somebody else's space, somebody else's sacred space. And these are all kinds of tragedy. They're intangible because you can't measure them. We talk about them, but they're there. We talk a great deal now about determinants of health, and we kind of pick and choose which one's most meaningful to us. I think in some respect, we talk about economics. This is all that whole area of having access to care or having health insurance and having the means to buy and be able to afford care. The political arena is something people really don't always want to touch. But increasingly, we are forced to have to depend on political decisions to be able to have access to health care. And for Native people in this country, that has really been the driving force behind what is available to them. The legislative congressional decisions make some determination about what kinds of fund and how much dollar will go to keep this population healthy. It is not something that is entitlement. It comes from discretionary types of decision. So therefore, you never have adequate health care It's always bargain, and it's always at the bottom line. And that makes healthcare delivery system, in many cases, very unsafe. Environmental, of course, we pay a lot of attention now to it in many ways, but again, we tend to sort of select what we like to think that we can control. We don't look at the whole picture, we look at selective types of causes of different kinds of illness. And we often put the responsibility on the individual. If you live in a polluted air, you should move. If you smoke, you should stop smoking. If you have an unsafe housing, you should do something about it. So all these kinds of things come back kind of in a circle, so nobody wants to take the responsibility, unfortunately. The social area of determinants of health can be very wide or it can be very narrow. Many of these things that are important to Native people or Indigenous communities are often missed in that discussion. The one in particular has to do with cultural kinds of things. The other has to do with the spiritual types of that kinds of factors that influence health. I want to talk a little bit about how Native people are trying these days to sort of deal with some of these problems. We have a lot of community activity going on at the community levels that try to take these on in ways that are meaningful to them. We have a lot more activities in prevention. We have a lot more early screening, such as breast cancer screening for a variety of other things that were an important part of our health delivery system for a long time. And this is a very kind of positive movement, I think, in many respects. We also have a lot more emphasis on special chronic diseases. Asthma, for example, is prevalent now in many of these rural communities that have always been sort of the big health problem for people in the urban areas are now spreading into the rural environment because of air pollution, variety of other toxic symptoms. We also talk about ways that we can revitalize our spiritual and cultural resources to tap into some of these things, leveraging these strengths so they can once again be useful to improving the health of the population. And many of these kinds of steps not only taking the idea of reviving food practices and maybe a variety of other traditions, but also to talk about re-entering and reintegrating the role of spiritual healers and those people who are knowledgeable about how to stay healthy and how to maintain that balance and the straight road that was talked about earlier. Spirituality is a very important part of health. We have some religious groups in this country that rely primarily on prayer and refuse to go to medical service. Native people, to a large extent, utilize all kinds of resources. They're very pragmatic. But the bottom line is that they feel what gives them strength and what gives them the will to live, as well as giving them the balance to deal with many of the frustrations that come their way, is rooted in this sense of spirituality that's very important. Religion is another thing. Religion is something that's a little bit more structured. But when we talk about spirituality, we're talking about that inner sense of strength, faith that lives there, that you are able to come and utilize in a variety of different ways that doesn't really relate to belonging to a particular organized religion and or go to church on Sunday. Spirituality is a personal as well as a group kind of way that you acknowledge your place in the universe, that you're only part of this web of life. We are placing a lot more emphasis on looking at the whole community's health and wellness, remembering that many of the rituals activities and ceremonial activities take into account not only the thanksgiving we give for the kinds of harvests that come our way at the harvest time, but also to celebrate new life and also to celebrate the continuity of the kinds of people who live in our community, and that in all of this, we're responsible not only for people who live next door to us, but who live among us. We are making sure that we come back to the notion of preparing people for a responsible life. In many ways, this is done through the various types of puberty activities that was also well described in the presentation before. And in some of these areas, these are rituals to which everybody participates and gives knowledge to the fact that we are hoping to have people who are responsible, who will be able to be the future leaders of the communities. This particular one is with the sunrise ceremony with the Apache Nation in Arizona. So we have a lot of different ways that we're addressing environmental kinds of concerns. I think that the kinds of things that we're doing are in line with many other things that are happening across the country. We are trying to do something about toxic waste. We're trying to do something about be sure to reintroduce some healthy ways to produce safe food, to revitalize some of the native seeds that have long been replaced by all these genetic or altered kinds of seeds that now grow that may turn out to be and are turning out to be not so healthy. So there are many variety of different activities that are going on in various different communities. And that's what we call tapping into culture, leveraging culture to address some of these health concerns that are close to us and that are environmentally related. So we are seeing a greater participation also in making sure that whatever is taking place, any intervention is really culturally appropriate, culturally sensitive, and culturally acceptable. We are making sure that we're addressing more than just food source. We're talking about literacy. We're talking about spirituality. We're talking about relationships and all those kinds of responsibilities that come with making sure that we are more than just responsible for ourselves, but we're responsible for our community and for our environment. And I think we are also making sure that at the heart of all of this activity is we get together to celebrate and give thanks to the sources and the resources that sustain us. In many cases, this is a thanksgiving to Mother Earth for what she's able to do, because that's from her the food sources come, and it's from her shelter comes, and from her comes all these other living things that are part of our life on this planet. So I want to sort of, and I'm on time frame here, and I'm down to my last minute. And so I just want to say that I think we tend to romanticize some of these things when in fact there are realities and they have a long history. And as is said before, there is science in these things. And I think people survive because they learn from their mistakes, and they also learn to appreciate and live in harmony with those things that are around them. Thank you.